Having taken an history from the patient, noting those things that we have discussed, such as alcohol, previous alcohol, smoking, consumption of hard drugs, finding out whether the patient has any form of abnormality when she was born, this sexually transmitted disease. The next thing we do for our patient is to try and do a physical examination. When we do a physical examination, what are the things that we pay attention to? We take notes of the general signs, such as the development of secondary sexual characteristics. And this reflects normal level of androgen production, which includes, we look at the hair distribution. We find out whether the breast is enlarged or small, which we refer to as gynecomastia, or whether there is presence or absence of gynecomastia. Also check whether the patient has very good muscular structure, the skeleton is well formed, there is no form of abnormality, or there is gait abnormality. We go ahead to examine the genital, which is very key to us. One of the first things we look for is to localize the penile urethra. Penile urethra is where the sperm normally passes out through during the course of ejaculation. We want to find out whether it's up, down, or is turned backward, or if it's normally positioned. We also check for the testes. The testes will check whether the testis is present or is absent. We check for the size of the testis, and we also at the same time check for the consistency, whether the thing is smooth or rough of the testis. Because we found out that the patient that has some degree of infertility has a risk of developing testicular cancer. Sometimes we can go ahead to use a fetal instrument which is called oxidometer to ascertain the volume of the testis. Now, we go ahead to also examine what we call the epididymis. Epididymis is where the sperm are stored. Now, we check for the size of the epididymis, we check for the texture of the epididymis, we check for the position of the epididymis, we also check for the orientation of the epididymis, whether the epididymis is present or absent. From the epididymis, we now move to the vas deferens. Vas deferens connects the sperm, the epididymis, to the ejaculatory ducts, whether they are present or absent, whether there is any form of swelling, which is called cyst, or whether it's hard or nodular. This will tell us that, oh, there is an abnormality in the sperm. The other thing we check for varicose. Varicose is the dilatation of the veins in the testes. This varicose basically sometimes too tend to increase the temperature of the testes, and have been found to be associated with low sperm count. So we check the kind of varicose, whether we can easily see it when the patient is standing, whether when the patient moves, or what we call the vasovagal maneuver, whether we can see it. We check basically for those for whether there is varicose or not. The last thing we now check for is to examine the rectum, what we call digital rectal examination. Now, this will help us to check if there is any swelling in the prostate, if there is cyst, if there is any if there is enlargement of the prostate, or if there is a tumor in the prostate, or if there is any form of changes, or if there is pain in the testes, in the prostate. These are the basic examination we do for patients who comes for fertility evaluation. Hope you have learned one or two things in this my discussion. Thank you very much. My name is Dr. Edukpolo Osazua, the Doctor of Hope. Thank you for listening.